You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. As April is National Foot Health Awareness Month, a month dedicated to raising critical awareness around foot health, it's appropriate that on today's show, we're putting our best foot forward, literally, as we explore a foot condition affecting millions of people, bunions. We are deep diving, breaking down what bunions are, why they happen, and what your options are if they are already a part of your life. And to help us do so is our guest, Dr. Brad Schaeffer. Dr. Schaeffer is a board-certified foot surgeon with the American Board of Foot and Ankle Surgery. He trained at Hoboken University Medical Center with a 3-year comprehensive foot and ankle reconstructive surgical residency. After residency, Dr. Schaeffer has continued training and crafting his skill set in cutting-edge surgical techniques and regenerative medicine. Dr. Schaeffer was also discovered for the hit TV show My Feet Are Killing Me in the TLC, where he is known for bringing his eye of aesthetic medicine and attention to detail to every patient that he treats. Dr. Brad's contributions extend beyond the podiatric community, which led him to be honored by the Arthritis Foundation of America for his dedication to healing those impacted by arthritis. He was also chosen to be the keynote speaker at the Boston Podiatric Conference of America, where he led a dialogue for a healthier approach to managing podiatric practices. He's an expert, a professional, and empathetic. Dr. Schaeffer understands that each patient is unique and takes great pride for treating the person, not just the symptoms, because he believes that everybody should live a pain-free life. On the show, we're talking about bunions. What are bunions? What causes them to develop? What happens if they are left untreated? How bunions can affect upstream other parts of the body and our posture? And what is Lapiplasty? What is this procedure and how does it work? Please stay tuned, especially if you are a person that is currently dealing with bunions. I think you're going to find this very informative. We will be back in just a few minutes to speak with Dr. Schaeffer.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. Please do follow us on our social sites. We are on X, Facebook, and Instagram, and we are at the Health Hub RMC on those locations. Dr. Schaeffer, welcome to the show.
Thank you so much. I'm excited to be here.
Well, I mean, feet are a big thing, right? And I don't think we appreciate the value of them until they start hurting.
That's right.
And we're going to get into all of that. Tell us how you got it. Now, we are covering the topic of bunions today. Is this solely your expertise now? You've pigeonholed down into this?
I've always been super passionate about feet, and they are the best thing around. So if we don't have them healthy, we are not going to be healthy and living our best life. And as far as bunions are concerned, they're one of the main things that hurt us. And they need some love too. So bunions have definitely become a forte at Soul, at my practice, Central Park Soul.
So there must be a lot of people that have bunions. They can support a practice.
So many people have bunions, and it's definitely not my main thing, but it's probably one of the main focuses for sure.
People may know you from your show that was called My Feet Are Killing Me. Is that still in play now, or is that something that has run its course for you?
You know what, Kathy? We were on 5 seasons, and it was the best thing that has ever happened to me. Loved it. Really helped a lot of people, but it is not going any longer. And it was 5 seasons of showing people some foot love, and I was happy to have it.
It's amazing to me that you can have 5 seasons of a show on feet when they are so ignored by the general population. I had a lady on the show a number of years back, and we were talking about feet too, from a different perspective. But tell us what happens if we do not take proper care of our feet. How does that upstream effect impact our whole body?
Yeah, that's a fantastic question, and one that I get asked a ton. And it's kind of how we opened in regard to, if your feet hurt, you cannot be active, you cannot live a healthy lifestyle, you can't run after your kids, you can't start working out, maybe just lose weight, or if you're trying to slim down. It really affects everything. If your feet hurt, your knees hurt, your hips hurt, your back hurts, and all starts with our feet. They are our bedrock and foundation.
I still suffer a little bit from plantar fasciitis. And when I started with my trainer doing weightlifting, she focused highly on the feet and the musculature of the feet and how important they are. She had me do one exercise where I sat on the top of my feet, my toes underneath.
Yes, yeah.
I nearly went through the roof. I couldn't handle it. And from that moment, like just the impact of what that one simple little test was. I work regularly on my feet, using the ball, using little anything just to rub them up and down and try and get some relief from that. But is this a phenomenon, or bunions, when we get into the into this space here of bunions? Mm-hmm. Is this something that is are bunions something that are hereditary, or are they developed through poor foot health?
Another very good question. A lot of people think bunions are because maybe the shoes that we wear, maybe, due to a trauma. Listen, yes, the answer is all of the above. But most of the time it comes from our mother, father, grandmother, grandfather, things like that. So it is hereditary. There are also people out there that are born with bunions. It's a juvenile bunion, and it's common. Yes. So it is not always due to the footwear or the lifestyle.
The juvenile bunions, we're going to get into the surgery and what you're doing.
Sure.
But can you treat juvenile bunions differently than bunions that have been developing over many, many years? Can you do more of an integrative approach?
Yeah, you would really just try to offload support and get a child through the growth phase, because you cannot work on any part of a body that has growth plates. So there are ways that we can fix, help, and alleviate pain, but most of the time you would try insoles, whether it be over the counter like Dr. Scholl's, or whether it would be a custom orthotic like we would do in our office. All of those would offer you the support to just get you through until adulthood.
Just a personal question on my end here. Sure. Those toe spreaders that you put in, between your toes that spread them out, are there any value in this?
So as far as toe spreaders, separators, or yoga toes are concerned, they are fantastic while wearing them, right? Mm-hmm. So if we're active and our feet start barking at us, it's great to throw them on and just kind of get some blood flow, get some relief, and just have something like that in our toolbox to just help and assist us. But that is nothing that is going to prevent or fix a bunion.
Okay. And just as an overview here before we get, deeper into the topic, as we age, I know constant pressure walking, just builds. Mm-hmm. But as we age, should we expect to have changes in our feet?
Absolutely. Our whole body essentially changes all the time. And the more that we strengthen it, like for instance, if we strengthen our core, our lower back is supported. And all of that will help our joints, and it will help alleviate arthritis now and in the future. So yes, it is important to, strengthen, like you were saying, our feet and the rest of our body in turn.
Can we have proper posture and proper alignment if our feet are not good?
You can definitely work on it, but yeah, exactly. Our feet are, our bedrock. They are our stabilizing. They are our stabilizers that we need every day. So no, you can't necessarily have one without the other, but you can certainly troubleshoot.
Okay. So let's get into bunions. What exactly are they?
So bunions are a deformity in our big toe joint. It incorporates the metatarsal, which is one of the bones that make up the bunion, and it's called our first metatarsal phalangeal joint. And if you look at your thumb or your big toe, that is where a bunion develops. And it is a painful looking bump or protrusion on the side of your foot. And the bones that incorporate are your metatarsal and your phalanx. And I know that's a mouthful and a lot of people don't get it, but think of a painful bump on the side of your foot that's barking at you every step. That is a bunion.
Now, do bunions flare up, or are they a constant source of pain?
Depending on activity, they would flare up. As far as a constant source of pain, that would be a more progressed or advanced bunion. That would hurt every step. But, if you're going out for a run or you're going for a workout, that's going to hurt you more.
So
especially the shoes that you wear, especially with the shoes that you wear.
Do you recommend a certain type of shoe?
I always recommend insoles or something to support a foot. I really like the shoes out there right now that kind of have a rocker bottom. I like the company MBT. I think they're great. Everyone's kind of rocking like the Hokas nowadays. Mm-hmm. But anything with a mesh is going to really help you. But the insole is going to offload the ball of the foot and the bunion bump. Mm-hmm. Can't recommend insoles anymore. Love them.
Do you need a toe that is wide, or I don't know what the proper word, like ovalish at the top?
Wide toe box. Yeah, a wide toe box is one of the things that we look for in shoes. Okay. When you have a painful bunion. So yes, that's super important. And the material that make up shoes, like a mesh or elastic, more over like a leather.
Do people with different arches, is one arch more, would you say, okay, you've got a flat arch, you may be more inclined to develop a bunion, or is it just extremely random?
A lot of times it is due to foot type. So if you have a flatter type of foot, you are more inclined to develop a bunion. It's kind of like when your arch collapse, your knee goes in, your hips go forward, your back kind of protrudes, and then, everything is overcompensation. Mm-hmm. So our feet will overcompensate for our flat foot. Our flat foot will overcompensate maybe for our knee type or hip type. Or maybe if we're carrying a little more weight, these things happen from time to time. So it really is a cause and effect.
So if bunions, you're dealing with someone who hasn't inherited a bunion or bunions, mm-hmm. Is improper use of the foot one of the key causes? Like, is there a prevention path to bunions?
I would say, again, most of the deformities that we see, and I want to educate that it is very, very, very common that it's hereditary. Okay. So people out there, look, if you're going and, wearing high heels every single step you take, the narrow toe box, the more protruded up that you are in kind of walking on the tops of your feet, or the ball of your foot, that is going to probably your future is probably going to be a bunion type future if you do that. Same as anyone doing anything. Runners are more common to have maybe Achilles tendonitis or metatarsalgia, which is ball of foot pain. So it really is activity too, but more commonly it is hereditary.
Now, are males, do you see more males or females?
Mostly I see more females. I don't necessarily know the science on that. I kind of think that it's because men tend to neglect a little bit more of their feet than women, and maybe are less cognizant or maybe more not caring too much about it, about the look and feel of it. Again, you can kind of wear athletic sneakers or boots to work versus, maybe a slimmer type of shoe or pump. That's obviously going to hurt a bunion more than a sneaker.
And what, sorry?
It all depends.
It all depends. I'm thinking of ballerina toes and things like that, and skaters' toes.
That's one.
Do you see a lot of those
sure.
in your practice?
Ballerina, yes, absolutely. I'm in New York City, so the performing arts is a big driver of our patient population here.
I remember my kids were taking skating lessons, and one of their instructors used to wear skates without socks. It was just her thing.
Oh my gosh! Wow.
And she took her skates off one day. I was like, whoa. And she said, I'm in skates all the time. And, this is the negative impact of them. And they were they were formed to the skate, the toe of the skate, which is something
incredible.
And as someone who has experienced foot pain, I can't imagine living every single day with that pain. Mine at least subsides. And what are the treatments? We know surgery is one of the treatments, and we'll get into that. But is that the go-to? Was that the very first place that people are directed to when they come in and they're in pain and want to get rid of the unsightliness of them? I guess is also an issue.
Sure. Look, as far as a bunion is concerned, if you don't like it, we treat a lot of that for cosmetic purposes, but a bump on the side of your foot is going to cause pain. Whether you don't like it is one thing, but it's going to cause pain now and or in the future. So I always tell people, you might as well cut it off at the pass and just get it taken care of sooner rather than later, especially if you have the time and the resources. The stuff out there right now has been an absolute game changer for our feet. And that's why I'm so passionate about bunions. I love treating them, and I love helping people and performing surgeries if and when needed.
Now, where is the pain of a bunion? Is the pain in the actual structure of the foot, in the bone, or is it from the rubbing?
I would say a lot of people experience the pain on the inside of the foot where the bump protrudes. The rubbing is mostly when they're wearing shoes or heels or things like that. So the rubbing can be prevented by, just say, if you're in Florida and you're wearing sandals all the time or something like that. But most of the time it's due to the constant pushing against the bump. And the bump is called our medial eminence, and it is painful.
When people have gone through treatment with you, gone through surgery with you, they go through their recovery. Do they actually have to learn how to walk properly?
After?
Yes.
That's actually a good question. I always try to put my patients through physical therapy. It's not always needed. For instance, if you're a younger, active individual that knows how to stretch properly and stay in shape, you can kind of do these things at home with the proper active passive stretches that I provide. Shoe gear that we always discuss, like we just discussed with MBT, Hoka, and proper insoles like Dr. Scholl's or Custom Orthotics. If you do these things, you don't necessarily need to go to physical therapy and relearn how to walk. More an older individual, let's say, just to kind of get your body moving again, stretch properly, it is nice to go to a physical therapist and get some help.
I'm just thinking of someone who's been suffering for many years, bites the bullet, has the surgery. I mean, as we talked earlier on in the show, how the feet impact posture. I imagine, if you have a bunion on one foot, maybe the hips are impacted.
That's correct.
It could be quite a process for some people to, you heal from the surgery, you heal from whatever process you're putting them through, and then everything else kind of has to be realigned. So it could be a process for some people. And I imagine, you can tell me if I'm wrong here, that the musculature structure of the foot is different after a surgery?
Our body definitely learns how to compensate very fast. So as far as like relearning how to walk, I guess the short answer would be no. You do not have to do that. Although your foot is in a different shape, you want to talk about like learning how to walk in a negative way would be due to the pain that you have from a bunion, due to the cascading effect to your knees, your hips, your lower back. When you are supported properly and that issue is fixed, I would say you're learning how to walk then freely.
Okay. Let's take a break here. We'll get into the second half of the show, and we're going to talk about the new surgeries that are being performed with respect to bunions, and we'll talk about, the history of treatment. So everybody just stay tuned. We'll be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub. We are talking with Dr. Brad Schaeffer. Dr. Schaeffer, April 15th, which is a week today from our show recording here, is National Bunion Day. How proud does that make you?
Very, very. Again, it's something that I've trained a lot on, and to see people walk into my office in pain with something like this and walk out pain-free after a treatment, or just reassurance that I can help and assist, that's all that matters to me.
And what awareness are we trying to make with National Bunion Day?
To make people aware that it is common, and it is normal, and it is not gross, and it is an easy fix. It used to be a very challenging thing to treat because a lot of people weren't necessarily trained properly on how to do it. So there were a lot of horror stories out there. And just to make people aware that there are fixes, it's common, and we are here to help. Is, I think, the best thing that we can offer people during this great day in the podiatric world. in the foot game, it's
great. Foot game, it's a game changer. Okay,
that's it. Let's rock with that.
Okay, when I think of bunion treatment, okay, here's what comes to my limited capacity for this whole topic. I think of toe spreaders and surgery that shaves the bone. And I don't think that that's something that's not uncommon with people that don't dive into the topic, which would lead many people to think of an extremely painful process of getting bunions removed. So you kind of intimated a bit that things have come a long way, but where were things before and where are things now? And why should we be spreading that fear does not need to be a part of the game?
In the past, I would say there were a lot of people out there that weren't trained properly. Our training nowadays is very rigorous. We all go through surgical reconstructive residency programs in podiatry. There are also orthopedic surgeons out there that go through extensive training on feet and become specialized in that versus other parts of the body. But speaking as a podiatrist, we are foot and ankle surgeons that go through 3 to 4 years of residency training to fix this. In the past, that was not the case. And as far as the procedures that were out back then, and the advancements in the technology like plates, screws, staples, things like that, it is very streamlined, and your recovery process is very, very, very good nowadays versus before. Before, it used to be 6 to 8 weeks recovery. Nowadays, we can get you up and walking the same day. Just like knee surgery has advanced, you leave the hospital, you're walking on a new knee. Same thing with the foot.
The newer surgery is called Lapiplasty. Is that right?
That's definitely one of my favorite procedures that I do.
Are there other
3D
ones?
bunion correction. That's a 3D bunion correction, and that is called the Lapiplasty procedure. And that is definitely my go-to. As far as other surgeries, and the ones that we were just talking about in the past, there were procedural names, and one was called like an Austin Aiken bunionectomy, and that's a procedure at the top where you're kind of just shaving off the bunion bump, which was called a McBride bunionectomy. I don't think anyone's going to know this, but all the podiatrists out there are repping the old procedures, right? Mm-hmm. So that was at the front of the foot, shaving the bump, and then you can shift the bone over a little bit and hold it in place with screws. That's called an Austin bunionectomy. The ones we do now, we actually take the whole bone, which is where the bunion starts and develops from. And that's the metatarsal that we discussed in the beginning of the podcast. And if you fix it at the base, you really think about like a Leaning Tower of Pisa analogy. Mm-hmm. If you fix that structure and you fix it at the base, that'll be a perfectly straight building. If you fix it at the top, it'll still be jagged and look wonky. Maybe a lot of people will still go to it if it looks like that. But if you fix it at the base, it'll be perfectly straight. And that's what we want our bunion to be. We want to fix it at the base. We don't just want to put a Band-Aid on it up at the top.
Okay, so my idea of bunions are changing here. Is a bunion a growth of the bone or just a misplacement of the bone?
You know what it is? It's actually a 3D issue. So that bone that I'm discussing is the metatarsal, and it rotates. So it rotates in a way where the head of that bone, just kind of around where the ball of our foot is, it pushes out the side. And when it pushes out the side, it rotates and it creates an issue in a 3D plane. So we fix it in all three planes by rotating it at the base, where we do that procedure that we were just talking about, which is called the Lapiplasty, or 3D bunion correction, a la what I was just saying, right?
So the bone is not misshapen, it's out of place.
The bone is not misshapen. That's correct. It is an issue where the metatarsal gets aligned in a negative way due to, again, flat feet or different circumstances in our life.
Yeah, I thought it was a growth. Does this involve breaking the bone of the foot?
With the procedure that I like to do, again, the Lapiplasty procedure, you are not breaking anything. A lot of people used to think that when you do surgeries like this, you're cutting in a bone and you're breaking it. No, we are actually realigning the joint space and holding it in place with staples or plates. No, we're not breaking any bone. And in the past, we weren't breaking any bone either. We were cutting into it with a saw and realigning it with that and holding it in place with screws.
So what is recovering then after the surgery? Is it the actual joint encapsulation there and the muscles and the tendons?
Yes. Just say you are, taking care of a joint due to, just say, arthritis. A lot of people experience, joint pain. Parents, whatever, experience arthritis. Well, the way you fix something like that is you have to fuse a joint together. And in our case, we fuse it together in a straight position so that bump that is in the front of our foot is now out of its 3D rotation and realigned.
Interesting. And so what is the recovery period for the Lapiplasty surgery that you do?
What I usually do with patients is I do a 1 to 2 week non-weight bearing phase, and I'll usually do crutches or a knee scooter with patients for that. There are doctors out there that weight bear them immediately, but in a walking boot. They're called cam walkers.
Right.
I personally don't do that. I just like to really protect everyone during each phase, but you can walk immediately after it in a walking boot. My patients, I like to do 2 weeks non-weight bearing. And after that, you're in a sneaker. And you're in a sneaker for 4 weeks, walking around. Activity-wise, it's not like I want you running or anything, but you are able to walk.
Does this surgery involve lacerating the skin?
You have to cut into the skin, yes, to perform the procedure. Mm-hmm.
Is it common to have bunions on both feet, or is it usually one foot?
It's definitely common to have them on both, but there are a lot of people out there that only have it on one.
Can you get? I guess you can't get both done at one time if you in particular are not having them weight bear. So, do you get them one right after the other, or is it 1 year after the other? What do you recommend?
Depending on the patient, I like to really just gauge their activity level, whether they're able to take care of themselves. For instance, if you have a spouse at home, or maybe you have a ramp or something like that, or a lot of doctors do perform them at the same time. In my opinion, I like to wait, and I like to wait around 3 months to do both.
Okay,
so I'll do one, and then around 3 months, I'll do the second foot. And again, just because I'm just super cautious and I want it done properly, and I don't want them to have a second surgery. But there are a lot of people out there that do both.
How long is the surgery?
And there's nothing wrong with that. The surgery is performed in about 1 hour. And if you need other things done, maybe it would get to the 2 hour marker, but it's about an hour.
And any risks that you would want to indicate with the surgery?
Yeah, sure. As with any surgery, it's, infection, maybe non-healing of the fusion site, which is where this is performed. That's with any surgery, though. Mm-hmm. Delayed healing, non-union, infection, things like that.
Is the Lapiplasty? It's the one that you recommend. It's the one you use. Are there others on the same playing field? Lapiplasty is a development within the field, but is there anything on the same playing field? Like, why would you recommend this versus the other current thing that's being done?
Yeah, with the 3D bunion correction and Lapiplasty, again, you're fixing it in all planes. They send you out to courses where you're trained on it, where you listen to lecturers, where you do hands-on labs with cadavers. As far as some of the other procedures are concerned, listen, they're good. They work. I feel like this one is just very streamlined to provide the patient with the best chance of recovery, and also more expedited recovery process. Weight bearing earlier, less swelling, less pain, and better long-term success, in my opinion.
If somebody sees or what they may anticipate a bunion developing, can there be care done to avoid surgery? Or is it all going to end up in some type of a surgery if you want it repaired?
So my thing always is early prevention, whether that be toenail fungus, arch pain, Achilles pain, or bunion pain. It's early prevention. Now, I always want to treat someone conservatively, depending on what they're going through in their life. So, yeah, you start with shoe gear, insoles, orthotics, things like that. That would all be conservative care. We always want to discuss with patients, you want to exhaust all conservative measures before a surgical procedure. But if someone needs it, we have the tools now that provide you a chance for early success and sustained success.
Have you yourself seen a bunion reversed without surgery?
Oh, there are no, definitely not. No, that's
okay.
You can alleviate symptoms, but never reverse, unfortunately.
How has the Lapiplasty moved your practice forward? Was it just a huge game changer for you?
I think just educating patients that there is a new procedure out there that people are becoming, the recovery process is a lot more streamlined, and that the long-term effects are not, like the bunion comes back and things like that. It's been out long enough to where it is tested, it's proven, the patient satisfaction level is super high. And then my life's easier because the patients are happy.
Mm-hmm. Fair enough. Are there people that are not being recommended for this surgery who have bunions, or is everyone can do it?
No, definitely not. If you have a small bunion, like just say in the bump area, you can do one of the other procedures that we were just discussing, and that's called a head procedure, like the McBride bunionectomy, where you might just go and shave the bump a little bit, or you might just do something with the big toe. That's called a phalangeal osteotomy, and that's called an Aiken bunionectomy. Those are for bunions that are less severe. Now, people that want to, fix it properly with the 3D deformity and rotation, you would really have to go in and do it the way that we were just discussing.
So why wouldn't you just do it?
Small little bump pain, you would just maybe stay with the problem and stay problem focused, depending on where someone is in their life. Why wouldn't you just do this procedure that we're saying is because not everyone requires a base procedure, which is what this is,
mm-hmm. Okay.
The 3D bunion procedure. It's just like maybe putting a Band-Aid on a problem and staying problem focused versus, going all in, depending on where someone is in their life.
What's the worst bunion you've ever seen? Like, what is one that has really stood out in your mind as being, oh my gosh, such an achievement when you're doing this surgery?
Check out season 1 of My Feet Are Killing Me. I could say the patient's name right now, but that would be against HIPAA. There is a patient on,
but he's on your show.
It's TLC. My Feet Are Killing Me. There was a patient on there that was by far the worst bunion that I've ever seen treated. And in my opinion, we knocked it out of the park, and she's super happy.
Did it impact the rest of her toes? Like, was everything kind of all crumpled and mulched together?
A lot of times with people with bunions, they'll develop like hammer toes or Taylor's bunion, which is a bunion on the outside of the foot. So it does have a cascading effect. Again, like we were saying, it's overcompensation. Mm-hmm. If there's one thing off, the toes will start to overcompensate. The knees will start to buckle, hips, back. It is definitely a cascading effect, which is why I always talk about our feet as like the foundation of our body.
Absolutely.
And we have to support them.
Now, we got
to make people aware, Kathy, right?
We do need to make people aware. And I'll tell you, people who have had feet problem, it's like someone who's had a back problem. Once you know, you know.
Right. Exactly.
And the simple little things that you can do to keep your feet healthy, but it's another show.
Right.
Where are you located?
But thanks for asking. My practice is Central Park, Seoul, and it's on 85th and Central Park West in New York City.
I'm assuming that most people that come to see you are within the state boundary. Do you take people out of state? I guess it depends on their insurance too. Do you ever have Canadians coming up your way?
Oh, absolutely. Due to the success of the show, we really marketed ourselves in a way to where, if people feel like they're lost or like they lost hope a little bit or have a botched surgery because of some of these old procedures just weren't working for them, a lot of people come see me, and we take everyone. There's no limit to who we take, and we always give them an appropriate personalized treatment plan at Central Park, Seoul. That's my practice.
Many surgeries? My baby. That's your baby, and that will be in our show notes. About how many surgeries would you say you do in a year? Bunion surgeries. since we're on the topic?
Ad nauseum, I would say. I definitely do them every week. I don't do them every day. We do other things in my practice. We're very focused on aesthetics and cosmetic recovery. But whoever needs help, I definitely take care of. But to put a number on it, I could not even begin to tell you. Very, very, very hard to tell.
And the surgeries are done in clinic, not in the hospital.
So there are doctors' offices that have surgery centers. Mine is one of them. I can do them in my office. I choose to take my patients to hospitals or surgery centers. Again, just to make sure that, we have an anesthesiologist present, infection control. I think it's more posh, more streamlined, things like that.
Fair. Well, wonderful. Thank you. So now if someone wants to get a hold of you, you gave us the name of your clinic. Do you have an email, Instagram, anything else you want to throw out for people to take a look at?
Please. Yes. My website is called www.centralparksoul. That's SOLE.com. My Instagram is Dr. spelled out Bradley. That's my Instagram. I do a lot of education through there. So you can follow me on Instagram at dr.bradley or on my website, which is centralparksoul.com. And I can provide you with those links.
That'd be great, because the one I have here is imagine.soul. Is that not you?
Oh, that's good. Imagine.soul is my practice.
Okay.
It is Instagram, and you can definitely add that. But the thing that I kind of got a little popular with, that was Dr.Bradley. Okay. And that was with all the TLC stuff and things like that. But Imagine.soul, SOLE, that is my practices.
Perfect.
Instagram.
Any future plans for being on TV again or radio, or are you just too busy fixing feet?
No. I have a lot of passions out there. I'm trying to open up a practice in Miami. So that is in the works currently. I'm big into health and wellness. So I'm huge into this company right now called Quantum. And what we do right now is we provide people with a meal prep alternative to weight loss. And we call it the cookie diet. So you can essentially eat 2 cookies in the morning, 2 cookies for lunch, and 1 for a snack with a balanced meal. And we have proven that you can lose a very good amount of weight by eating cookies. And it is fantastic. And when I'm on the go, it's easy to just grab 2 delicious cookies and go throughout my day.
Going to assume they're quantum cookies, not like Oreos or something like that. You can just grab them.
No, yeah, it's a meal replacement cookie mix, and it's Quantum, QUANTM. And that's quantum.life. And they're fantastic. The owner of the company is amazing. He developed this mix, during COVID. And I'm super passionate about the partnership.
Well, sounds like a new topic for a new show.
Oh, absolutely. Yeah, I would love to chat about it.
Wonderful. Well, I do appreciate
the cookie diet. Yes.
The cookie guy. Thank you so much for taking the time. To have a celebrity on the show is wonderful, but I do appreciate it. And I think we've really elucidated some of the myths about bunions and given some really key, solid information for people. So thank you for being on the show.
Good. I hope so. Thank you. Thank you very much for having me. And if you ever want to have me back to discuss the cookie diet, I'm all ears.
Absolutely. We'll talk in a sec offline. Everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.